Busy careers, searching for Mr. Right, single and fabulous. Yes, there is a long list of reasons why we are seeing a spike in females delaying motherhood. In fact, the latest figures show that for the past 30 years, the fertility rate of women aged 35 to 39 has more than doubled.
Yeah, mirroring this trend, couples are turning their attention to fertility treatments, but now with a twist. According to the Baby Whisperer, Dr. Lynn Burmeister, parents-to-be are making a holiday out of egg freezing procedures.
And fertility specialist Dr. Lynn Burmeister, the director of Number One Fertility in Melbourne, joins us live in the studio. Nice to see you.
Good to see you.
We all know, of course, about freezing eggs, but tell us, what are these holidays?
Well, I've had a lot of patients gaining interest in egg freezing, and so they're coming from all over Australia, and I've even had international patients coming over from New York recently and LA to freeze their eggs, and it's such a stressful time and such a big decision for the girls. So I thought I'd just make it a bit easier for them and just arrange their hotel room so it's close to where we are and close to where they're having their egg collection. They can stay a couple of days, not stress about booking hotels, and then fly back home after a couple of days after the egg collection.
Yeah, that's a great idea because it's really a bit of an emotional decision that they're making, aren't they? So what can a couple or an individual pay for egg freezing, and what is the success rate?
Well, it can be very expensive, but I've started a affordable egg freezing clinic, which is around about $2,500 for our clinic costs, and then the drugs on top of that are about $1,000 to $1,500, and then depending on their insurance, whether they have to pay for the bed for their egg collection. So all up, it may cost the patient about $4,500, which is probably about half price compared to some other clinics.
Okay.
Yeah, that's great of you to be able to do that for women.
I know, because a lot of the 30 to 35-year-olds, they struggle to come up with the traditional costs, which were $10,000, $12,000. And so to come up with $4,500, they can usually do that. They just miss out on their trip to Europe that year.
Yeah, but I guess you also maybe, pitch it to them that it's a small price to pay really for a peace of mind and giving you that opportunity to make a choice when you want to make it.
Yeah, and unfortunately I have so many women 40 who can't get pregnant with their own eggs, and they always say, I wish I froze my eggs when I was 32 or 33. So, I'm trying to get the word out there. Don't turn 40 and regret those decisions.
Better to get in early is the advice,
definitely,
isn't it?
Your eggs start to deteriorate even after your 30th birthday, but more so after your 35th birthday.
Yeah, because I was surprised to read that women are born with 2 million eggs. So what is the magic number? What's the age when it does start to deteriorate?
Well, even by the time you're 30, you've only got 10% of them left. So, and then by the time you're 40, you've got about 2 to 4% of them left. And their quality really dramatically starts dropping off, particularly after your 35th, 37th birthday.
Yeah, I wonder though, Dr. Lynn, whether what we often read in the press has a lot to do with women waiting, because we often hear of these miracle baby type stories, don't we, where women are having babies well until into their 40s.
And some people don't tell the truth. They'll come out and say, oh, I got magically pregnant, but they've gone off to Greece to get an egg donor. So, like a lot of the stories we hear, particularly with celebrities, may not be quite the truth.
Okay.
Yeah.
And with a lot of more egg freezing now, are we going to start seeing mums maybe in their 50s and 60s?
Well, we do have an age cut-off where we want them to use their eggs. So our age cut-off is 50. So we do have
because there then becomes a bit of a safety issue around that?
Or? Becoming pregnant after the age of 50, 52 might be a health issue for the patient. So we want a healthy mum and a healthy baby at the end of the day. So we want to be mindful of that as well.
Yeah, whilst I know egg freezing probably isn't necessarily the newest thing, it feels like we're talking a lot more about it in the last 10 years, which would suggest that technology is advancing. So where can this go? Where do we see it going in the next 30 to 40 years?
Well, I sort of think that most girls will start doing it at between 30 and 35 if they're single. A lot of patients come to see me, and one patient, for instance, recently said, I want to be a partner in my law firm. I'm not going to have a baby till I'm 38, so I need to freeze my eggs now. And she's 30, so she was quite direct in her decision there. So I think we're just going to see more and more of it. Yeah,
because we see a lot of women delaying motherhood. As we said at the beginning, it's fine to be single now. People are focusing on their careers. So good on you for making it cheaper for women.
Yeah, thank you very much.
Thanks, Dr. Lynn. Yeah, and any excuse for a holiday is a good thing, right?
Come to Melbourne, do some shopping.
Creating life's even better.
Yes, it's great. Yeah,
thanks, Dr. Lynn. Great to talk to you today.